Hello, good evening.
Good evening.
Yeah, how are we doing?
Thank you. Please, we are fine. And you?
Yeah, I'm also doing well. Okay, so today our discussion will be on the management of peripheral vascular disease. We started talking about peripheral vascular disease last week, and just a quick recap. So basically what we said is peripheral vascular disease is a disease that affects the peripheral vessels. And the peripheral vessels are basically the vessels supplying blood to all parts of the body other than the heart and the brain. So if it's the heart, we are dealing with the coronary vessels. If it's the brain, we are dealing with the cerebral vessels. Any other vessel, we are looking at the peripheral vessels. We said that peripheral vascular disease is subdivided into two. So we could have peripheral artery disease, or we could also have peripheral venous disease. And we said for peripheral artery disease, basically, the arteries are supposed to supply blood from the heart to all parts of the body. So when there is an occlusion, within the vessel, it affects blood flow to all parts of the body. So we said for peripheral artery disease, usually the most common cause is atherosclerosis. The other cause would be vasospasms. So we said for atherosclerosis, there are certain risk factors that can predispose you to getting atherosclerosis. We mentioned hypertension, smoking, diabetes, obesity. All these are risk factors to getting atherosclerosis. Then we also talked about vasospasm. Under vasospasm, we mentioned Raynaud phenomenon or Raynaud disease, where the patient gets vasospasms at the peripheries when exposed to extreme cold temperatures or stress. So this is triggered by stress or cold temperatures. So it causes vasoconstriction at the extremities, and that could lead to peripheral artery disease if it's not managed. So we mentioned these as the main causes of peripheral artery disease. For peripheral venous disease, we mentioned that the issue is with blood returning back to the heart because the veins are supposed to return deoxygenated blood back to the heart. So if you have an occlusion, if you have damage to the valves, damage to the vein walls, or overstretching of the veins, you can have blood pooling at the lower extremities. And that can lead to peripheral venous disease. And we mentioned some notable causes. We mentioned varicose veins. We mentioned chronic venous insufficiency. We mentioned DVT. We mentioned SVT. So all these are causes of peripheral venous disease. Then we moved on to talk about